Welcome to the world of PRP.
Okay, everybody, can you hear me okay? Great, thank you so much for coming. This is our first event on platelet-rich plasma, and I've been thinking about incorporating this into the practice for quite a few years. I had the brilliant idea a few years ago as I saw my skin changing, and I had heard that you can use platelet-rich plasma to kind of fluff up your collagen. And there's also some other applications that you're going to be learning about today. And I had my first treatment, I think it was 4 years ago? 3 years ago on Maui. And I was a little like, oh my gosh, that's intense. But I did see some pretty significant skin changes. I had another treatment last year that was very painful at a place, I don't want to mention the name. And I just thought, there's no way we can do this. I mean, it was just too painful. And then I had another treatment with Dr. Coles, and we did a lot of research on how to make this less painful. And I have to tell you, I think we figured some things out, which is great. Tonight, Dr. Coles will be speaking first. She's my associate. For some of you who don't know, she's been working with me for 5 years. I'm Dr. Laurie Steelsmith. Our office is upstairs. I think most of you are our patients. I think there's a few people that we don't know. And Dr. Coles is going to go ahead and tell you a lot about PRP and how it can help your bones and your joints and your tissues and what it is. And here's Dr. Coles. Thank you.
Okay, good. So welcome everybody, and thank you to the Lutheran Church for having us. We're actually really grateful we could accommodate all of you. We are going to have plenty of time at the end for questions and answers, so you can, hold your questions to the end, and then we want plenty of time because I know a lot of people probably have a lot of questions. We'll do our best to go through most of what PRP is in the beginning, and then we'll go into, I'll talk about the musculoskeletal and pain applications. And because I'm young, I don't get to talk about the facial stuff. Dr. Steelsmith will talk about that, and then some of the other stuff. All right, so this is what we're going to cover. I just basically talked to you about that. Regenerative medicine. Has anybody heard this term? A few of you guys have heard this term. This is really becoming the buzzword in functional medicine and naturopathic medicine as we're moving forward. And it's a concept that we have the power to not just treat disease, but to actually regenerate systems in our body. And PRP, platelet-rich plasma, is one of these key components to regeneration. And we're going to talk about why that is in just a few minutes. The process, regenerative medicine, is the process of replacing cells, tissues, or organs to restore or reestablish normal function. Platelet-rich plasma has been around since about the 1990s. That's when it first started becoming used in humans. Prior to that, there had been some usage in horses, racehorses. Racehorses, I don't know, I'm from Kentucky, that's where I grew up, and really interesting, racehorses and the vets that treat racehorses are like the cutting edge of medicine. They're doing everything first on horses. It's actually fascinating. So in humans, about the 1990s, we started using PRP in some dental procedures and then in sports injuries. A lot of the NFL players became some of the first to start using this for bad injuries to get them back on the field quickly. Here's a few of the main things that PRP is used for. So we have facial rejuvenation, we have hair regrowth, we have muscular and joint pain, we have sexual wellness, and we have aesthetics. And we're going to be talking about all of those tonight. So we're going to get into what platelet-rich plasma is in a minute. Because it's a regenerative form of medicine, it's going to help regenerate new tissue. It's going to accomplish this by the natural production of something called stem cells. Have you guys heard of stem cells? Yeah, a lot of people have heard of stem cells these days. There is something called stem cell therapy. PRP is not stem cell therapy, if you've heard of that. That's actually harvesting something called stem cells, which stem cells are cells that can do anything. They can develop into any tissue in your body. Any tissue. They're fascinating. And we can actually harvest those and we can inject stem cells. PRP is not that. PRP actually has the ability to recruit your own stem cells. And we're going to get into that in a few minutes. So, what exactly is it? You can hear by the name platelet-rich plasma that it has something to do with platelets, it has something to do with plasma. You guys might not know what either of those are, and that's okay. On the little picture here, okay, I'm going to use my hands. On the picture, those little guys are our platelets, and you can see red blood cells, you can see white blood cells. This is all of your blood. So when you see blood, it has a lot of different components in it, and platelets are one of those. When we are doing this procedure, it involves taking your own blood out of a vein and then spinning it down to extract something called plasma, which is a white, yellowish color, where red blood cells are a red color, and we actually extract that, and inside that plasma are your platelets. So what is so special about platelets? Anybody know? Platelets have multiple different abilities and processes to actually recruit those stem cells that I was talking about. So the platelets will send out signals all over your body where they're injected from. They will send out chemical signals to allow these cells that can turn into anything to all come and hover to where those platelets are. So if you inject this platelet-rich plasma into your face, you're going to recruit stem cells into your face, and those stem cells can then turn into collagen. We follow? Okay, so that could happen anywhere in your body. You want to inject it in a joint. Let's say we have a knee injury, an ACL, which is a ligament tear. You want to inject the PRP there. Those stem cells are going to be recruited, and they're going to turn into and help the regrowth of a ligament. Isn't that cool? So cool. I just love to geek out on that. All right, so they also release growth factors that are going to stimulate all this cellular regeneration. Growth factors are going to actually help your cells to heal. It's going to bring oxygen to the area. It's going to help blood cells and arteries and things like that accumulate in the area so you get more oxygen flow. Oxygen flow is going to bring nutrients. It's going to bring healing to the area. All right, so how does it work? Kind of went into this already, but a small amount of your blood is going to be drawn, and then we have a very special device that has to spin the blood down in a process to extract this plasma. Once we've extracted that plasma, it's then ready to be injected anywhere in the body. And the really amazing thing is that the PRP that we create can go anywhere. So if you want to work on your face, it can do that. You want to work on your hair, it can do that. You want to work on a joint, it can do that. So it's amazing. I was talking to my brother, who is a cardiac perfusionist. I don't know if any of you know what that means. I didn't before he became one. But these are the people who run the heart-lung machine when people go into open heart surgery. And so he's there with the heart surgeon in the OR. And I was telling him about the PRP because I tell him about all the fun stuff I'm excited about. And he was like, oh, yeah, I've heard of that. Some of the surgeons I work with actually extract PRP before the surgery. And then because during open heart surgery, they have to cut through the sternum, which is the main bone here in your chest. He said they will use it at the end of surgery when they're closing it up. They put the PRP all over the bone before they close the body up, because they know that if they do that, the recovery time is cut in half, and people are doing so much better post-surgery. If any of you know open heart surgery, it's very quite a long road of recovery for many people after. So there's fascinating usages just all with that same PRP. All right, so we all kind of understand what PRP is in a basic way. Good. So I'm going to talk about how we use PRP in musculoskeletal injuries specifically. We do have numerous studies on using PRP in musculoskeletal injuries. It's been shown to be very safe and very effective for joints, soft tissue injuries, ligaments, tendons. What's very, very cool is because it's coming from your own body, do you think you have any allergic reactions to it? No, we don't. So it's coming out of your blood, it's going back in your body. There's really never been allergic reactions shown to PRP. It also contains some immune system stimulants, which means infections or infection rate with using PRP dramatically drop. Another reason why heart surgeons are using it, because post-surgery, infections are a big, big deal. You use PRP, it's going to prevent infections from happening because of that white blood cell immune component that does exist in there. So it's very safe. All right, here's a long list of the conditions that PRP has been shown to be most effective, and you can see there's a lot on here. So we can basically think about any bone, joint, ligament, tendon in your body that can get injured. PRP can work, but we've seen it work very well for lumbar, which is your low back, so low back spine pain or disc degeneration. Rotator cuff injuries. Rotator cuffs are your shoulders. These are a really common injury. Any type of partial thickness tear even can actually be treated with PRP, which is phenomenal. Just shoulder pain and instability. Tennis elbow or golfer's elbow. So those pain when you have outside or inside of your elbow. Hamstring strains, knee sprains, knee instability, knee weakness. Patellofemoral syndrome, that's a knee condition where you have pain on the top of your knee. Ankle sprains, very effective. Achilles tendonitis, plantar fasciitis, which is a condition that you get on the bottom of your feet. Knee, hip, and other joint osteoarthritis. So if any of you have experienced arthritis or have, relatives with arthritis, a lot of times there's not a lot of great treatments that are offered. PRP is changing that. PRP is really going to come on board and make a big difference for the management of arthritic pains and even sort of the degeneration that's occurring with arthritis. Nerve entrapment syndromes. Carpal tunnel syndrome actually can be very nicely treated with PRP. SI, joint dysfunction and pain, that's the joint in one of the joints in your low back that attaches to your pelvis or your hips. Lumbar and cervical facet dysfunction and pain. So as you can see, we've got a lot of different parts of the body here that it's very effective in treating. I want to talk really briefly about an interesting study. Many people with pain, some of the first things that you're going to be offered if you go to see your sort of conventional doctor with some pain? Pain pills, steroids, right? Yep. So corticosteroid injections, those are steroid injections where they're actually using a steroid and they're injecting it into the joint. And there was a very interesting study that was done on tennis elbow, so that's the outside of your elbow, and it was a PRP versus corticosteroid injections. And what they found is that it was double blind, so nobody knew which treatment they were getting. They all just knew they were getting injections. They followed up to 52 weeks after the initial injection. So that was actually quite a long-term study, which is great. And we found that both groups, steroid and PRP, had significant decrease in their pain scores up to 12 weeks. So both groups did really well for about 3 months. And that is common with steroids. You'll feel fairly okay for maybe 2 to 3 months. PRP showed just as well as steroids for those first 3 months. What they found at weeks 24 and week 52 was that the cortisone group had no improvement anymore. Their pain was back, but the PRP group remained at very low pain scores. So the other piece that I want to kind of discuss is that PRP is long-lasting. The reason it's long-lasting is because it's actually regenerative. So we're not just doing a treatment to help manage pain or manage an injury. We're actually doing a treatment, yes, to help your pain, but to actually heal and improve whatever that injury or problem is. We know that even up to 1 year after a PRP injection, people are still seeing improvements, and when we do biopsies, like into the tendon, we can see that there's still remodeling and collagen production happening at a greater rate than previous. This is a little slide on the osteoarthritis. So knee arthritis, hip arthritis, shoulder arthritis, ankle arthritis, finger arthritis, you name it, arthritis, PRP could potentially be very helpful. All right, so I think you guys understand what I'm getting at, the benefits here, but we'll recap. PRP is from your own body. It's natural. There's nothing else happening. It's just extracts from you going back into your body. The injections carry very few risks, really low in infection, very low in allergies. You're going to have significant improvement in symptoms. It may eliminate the need for more aggressive treatments, such as long-term medication or surgery. So potentially, with a rotator cuff injury where you have a partial tear, management is maybe pain medication, maybe steroids, and wait until you get a worse tear, and then you can have surgery. I mean, I don't like those odds. I like PRP because maybe we can prevent that surgery down the road, which would be amazing. There's a remarkable return of function with a much shorter recovery time than traditional treatment methods. Results. If we did this for an injury, what type of time frame are we looking at? It's dependent upon where you've had the injury, and it's dependent on how bad the injury is. On average, most patients start to see signs of improvement in the form of reduced pain or increased function within 4 to 6 weeks. Sometimes you can see it even sooner, but generally that 6-week mark is going to be, people are going to feel like, wow, I'm really noticing something different. Are you a candidate? PRP injections are used on a variety of patients regardless of age or activity level. Could be used on athletes of all ages. Could be people living with chronic joint pain. It could be people who have an active lifestyle. It could be workers injured on the job. A common question that gets asked is, who would not be a good candidate? People who are not a good candidate are going to be people who have a blood cancer. So if you have a cancer in your blood, meaning a actual cancer that is blood related, not a solid tumor, we would not want to be extracting that and injecting it into other areas of your body. The other sort of population that is not going to be a candidate are people who have a low platelet count. And this is something that we test on a very easy CBC. And most of the time, if you have a low platelet count, you have another type of chronic disease and you would know that. So those are going to be the two big populations where we really wouldn't want to be doing PRP. Okay, I think we can hold questions to the end, or should I do mini questions just about the musculoskeletal, because we're going to jump into any mini questions about this? Yes.
So where do you inject it? Let's say I had problems with my patella. Where would you inject the?
Great question. So she's wondering, where do we do the injection? And what's really cool is that both Dr. Steelsmith and I have had training in something called prolotherapy, which is a deep joint injection therapy. We've had that training for probably 5.5 years now. So we've actually been doing deep joint injections for quite a while using a different substance. And the injections for PRP are going to be in the exact same locations. So for someone with knee issues, depending on what the issue is, we will go to the site that needs it. So if there's a specific ligament that's damaged, we're going to inject along the ligament. If it's the knee itself, we'll go into the knee joint. So there's different areas based on the symptoms you're having, based on any imaging reports you might have had done. Because if we know there's specific ligaments that have specific damage, we're going to go there.
So what about someone who has arthritis in the knee? Like I have a friend who's going to get a partial knee replacement.
Yeah.
Would that help her?
Yes. So with those type of things, obviously we're going to sit down with the person, we're going to take the history, we're going to look at any imaging that's been done to determine if they're a good candidate. And then for arthritis, we're going to go into the areas that are most common to get that arthritis. So most commonly there's two bones that sit on each other in the knee. In that little area is where in between those bones is where we start to develop the bone spurs that cause that arthritic pain and that decrease in range of motion. We're going to go in that specific area where we have the bone spurring, that kind of thing, because we can actually see that those bone spurs, which are calcium based, they're calcifications, can actually be reabsorbed by the body over time.
And built up so they don't need that gel or whatever put in?
That's the hope, yes.
Hope.
I mean, we can't make any promises.
What percent is it working, let's say?
So it depends. There's different stages of osteoarthritis, right? There's up to grade 4 osteoarthritis. I would say anything grade 1 and grade 2, definitely very worthwhile. Depending on grade 3 to 4, maybe not. That's going to be looked at in terms of imaging and a specific, the specific patient.
Can I switch topics in the PRP facelift? That's a vampire facelift.
We're getting there, girl.
We're going to get
I'm
there.
interested in that.
Yeah, I know. We're going to get right there in just a moment. Any other questions about the musculoskeletal? Yes.
Yeah, when you say you inject it into the ligament or the tendon that's damaged, what if that's not real clear? What if you've had multiple surgeries on your shoulder and you've had breaks and this and that and hardware put in? Can you tell for sure? And if you get it in maybe a different area, is there any harm in that?
There's not going to be any harm in the PRP going somewhere it shouldn't, because you can actually inject PRP anywhere. You can inject it straight into a muscle belly. You can inject it straight into the skin, and you're going to get healing effects. So it's the real issue is injecting a needle somewhere a needle shouldn't be. And that's where you need to make sure you're seeing someone with adequate training, because we don't want to just be fishing around in the top of your shoulder where we could hit a lung. That's not okay. So adequate training, meaning someone who's been trained, who is doing prolotherapy, who understands exactly where the anatomy is very important. And if you understand where the anatomy is and you know the landmarks of where is safe to inject, and there are specific injection landmarks that you can do even if you don't know an exact ligament. So, yes. Yeah.
Okay, so I have bone-on-bone arthritis in my hip.
Mm-hmm.
So an injection in the hip, the hope is that the cartilage is regenerated?
Right.
Is that?
That's the hope. So I'll give you a little short story. My mom is 68. She'll be 69 in September. A few years ago, she started having some hip pain, low back pain. Long story short, she was not getting the proper imaging done by her doctor where she is living, unfortunately. And eventually, when I finally pushed her doctor to get the right imaging done, we found that her hip was in almost in collapse state, meaning the degeneration was so bad that the head of her femur could actually collapse. And that's not good, clearly. So I actually sent her to a doctor just to do prolotherapy, not even PRP. And the prolotherapy treatments, which were done, actually gave her an extension of 6 months until she had to get her hip replacement. And when she did have her hip replacement, she had an accelerated recovery because prolotherapy, which is a little different than PRP, but it's sort of a precursor to PRP. Prolotherapy will actually also do regenerative effects in the joints. So she didn't even have PRP, and she had prolotherapy, and that gave her an extension. If she had had PRP done, I mean, that would have been amazing, but there wasn't a doctor I could send her for. So I think it's always going to be us sitting down with our patient, looking at their scans, looking at their reports, and determining based on what their goals are whether or not it's going to be, something that would be worth a try. If you're not in an acute emergency state, I feel like PRP is a very viable option to try in many different situations because it's not going to harm. If anything, it's going to help, and if anything, it might help a lot.
What's prolotherapy?
Prolotherapy is another type of regenerative injection therapy, and it involves glucosamine, which you might have heard, some people have heard of glucosamine. It's a nutritive agent to joints, and a nutritive numbing substance called procaine, and something called dextrose, which is medical grade sugar water. That mixture is injected kind of the same way PRP is, but in the joint only. Prolotherapy does not have any usage in the aesthetics. It's only a procedure for musculoskeletal injuries. But it has a similar type of effect in terms of recruiting collagen repair, improving outcomes, and many people, because of cost, might try prolotherapy first when it comes to musculoskeletal conditions, and then if that doesn't get them exactly where they want, they may then go to PRP. But honestly, PRP is replacing prolotherapy in a lot of situations nowadays in terms of musculoskeletal conditions.
Thank you.
Yeah. Any other questions? Yes?
Old injuries versus new injury, or like
Mm-hmm.
a one that's been
Right.
around for 15 years or more,
Yeah.
still effective for old injuries?
Yeah, so question is chronic versus acute injuries. Very effective for both. Yeah. A few caveats. Sometimes if the acute injury is less than 3 weeks old, we may wait a little bit before we inject. And the other thing is if you have had steroid injections, because a lot of times chronic injuries, you may have had steroid injections in the area, you have to wait a minimum of 1 month after doing a steroid injection to do one of these, because the steroid injection is going to render the PRP somewhat useless. Yeah.
Yes, in the back, when you draw the blood to use the blood, is that for one injection? So would one appointment be one injection?
Good question.
So it's, how much can we get from one draw? It depends. And a lot of times, let's say you're going to do an elbow, one blood draw will probably be sufficient for the elbow. If you're going to do a shoulder, one will be sufficient for the shoulder. If you want to do your shoulder and your elbow, we're going to have to actually get more. Yeah. Yes. Question? Was there a question over here? Yeah.
You mentioned staging with respect to osteoarthritis.
Yes.
And for instance, I imagine you're looking at a scan. And so what would, if it was stage 4, what would it look like in a scan? How would you be
So
able to
stage
determine that?
4 osteoarthritis, you're really not going to be able to see the joint margins very much anymore. The joint margins on imaging are going to be very difficult to determine because of all of that bone spurring and excessive arthritic growth that has happened. If you're interested later, I actually have some pictures in my little book. You won't see it if I hold it up, but I can show you some photos. Yeah.
But the procedure is still possible, even at stage 4.
Well, it is. And, one of the doctors that we learned under, he actually had some very interesting cases because in Canada, if you need a hip replacement, you might wait 5 years just because of how medicine is up there. You'll get it, but you're going to be down on the list. And he has a patient who would fly in from Canada and did these type of treatments, and she actually hasn't needed to get her hip replacement yet. And she was kind of like a worst case scenario, but there was no option. She had to wait 5 years, and she just couldn't live with the pain for that long. So, yeah, yes.
Where did PRP start, and is there a longer history in wherever it started?
The exact way that it started, I believe, was actually in animals, and then we moved to human use, and I think the 1990s was kind of the first time it really started to take hold. When the FDA actually approved it, I don't know that exact date, but I might be able to find it for you.
But it was U.S. It wasn't in another country.
I'm talking in the U.S. I'm actually not sure about other countries. So FDA approval, I know, was in the 1990s here. Yeah. Yeah.
Where do you draw blood from? What part of the body?
So anywhere that we have a vein that we can access easily, usually along the arms, either the antecubital fossas. Sometimes there are veins along the wrist or the hand. Those are going to be our ideal locations. So just like if you've ever gone for a blood draw at a lab, same place. Okay, well, I'm going to pass it over to Dr. Steelsmith. So now you guys can hear about all the rejuvenation, other exciting stuff, and thank you.
Thank you.
Okay, hi guys. Okay, so one thing I wanted to add is we draw about 30 mLs of blood. Okay, so the test kits that we purchase, they're 30 ml test kits, so we draw about that much blood. Okay, then it gets spun down, and there's these FDA-approved kits that we need to purchase ahead of time, and this is why the expense of PRP is much more than prolotherapy. And we have to spin it down according to these very specific instructions with this very expensive machine. And it all spins down, and then it goes into another thing, and you draw it back, and then you spin it down again, and then you draw it back. And it has to be done in a very sterile, precise way. Okay? I am 55 in just a few months, so I do need these off and on. Okay, we're going to be talking about hair loss for both men and women. The top 10 reasons for hair loss. Now, I see a lot of women with hair loss. In fact, I've seen women who are freaking out because of hair loss, and it's very scary for them. They can have male pattern, what's now called female patterned hair loss. They can start to have an autoimmune hair loss because their immune system's attacking itself. They can start having hair loss on the crown of their head. And I can tell you I've more treated them for anxiety than I have for their hair loss. But now I feel like I actually have something I can really help them with. So some of the reasons why people have hair loss, well, genetics is one. Skin and scalp condition, I'm going to say really autoimmune, and that would fall under medical conditions as well. High stress. Anybody here had hair loss after high stress situation? Anybody have hair loss after pregnancy? How many during lactation? That's a big one too. Big hormonal swings can cause hair loss. Medications, anybody have hair loss because they took a medication? Nutritional deficiencies, that can cause hair loss. I had a patient come see me who really, truly needed to see a psychiatrist and really, truly needed to be put on medication and really, truly didn't want to hear it. And she was a vegan beyond vegan. I mean, she ate nothing. She really ate nothing. I drew her blood, and I found a severe zinc deficiency. I mean, severe zinc deficiency. And I explained to her that that could be a major cause of her hair loss, along with really protein malnutrition, because her protein levels were also very low. She was not willing to cooperate or change. She clearly has an eating disorder. I really never saw her again, but she came to me for hair loss. But really, her problem was lack of adequate nutrition. Gender, well, gender and genetics kind of go together. We have men who start losing their hair in their 20s, and that can be pretty devastating. Some women, their mothers have lost a lot of hair, they start to lose a lot of hair, and that can be very scary. And then certain hairstyles, apparently having the hair being pulled on all the time can also lead to more hair loss because it actually leads to stress at the level of the follicle. Statistics, well, male pattern and female pattern baldness are both the most common. We have seen autoimmune hair loss as well. So when people have their autoimmune disease under control, then we can start to work on stimulating their hair to create hair again. 60% of hair loss sufferers would rather have more hair than they would rather have money or friends. 75% of the population thinks their hair loss can't be prevented or treated, and the number of hair loss seekers seeking professional help has doubled in 2006 to 2008. This is a very personal issue. I was so pleased to find out that PRP can help. Injecting into the scalp is not that much fun, but we do have some devices to make it more fun and to make it so it doesn't hurt quite so much. For women, 50% of women are affected by hair loss. I think that's a pretty high number, but we do see a lot of women coming in, especially around menopause, post-menopause. A few of my patients were overtreated with testosterone by other doctors, and then they had dramatic hair loss when they took too much testosterone. One patient said she took too much testosterone and she didn't get the hair loss till she came off the testosterone. Excuse me? Oh, sorry. I thought you had a question. Women are more likely than men to seek treatment for hair loss. I think a lot of men just think, oh, there's nothing I can do about it. This is just part of being a guy and aging. 40% of men aged 35 have noticeable hair loss, 65% at age 60, 70% at age 80, and 80% at age 85. How does it work? Well, it revitalizes the hair follicle, right? So it's rejuvenating. I know, so ouch, right? Okay, you want to see some of the cool things we have? Okay, so we've been on the warpath to make this painless. Spent many hours seeking and searching. This little vibrating device, you can hear that? Okay, so you put this up against the area you're going to inject, and it distracts the pain of the needle going in. Okay?
Is that micro needling?
Well, we can do micro needling, or we use a 30 gauge, very small needle, and we just go right under the skin. Okay? But this little guy really helps. We also use a numbing agent that we have people put on. It's called BLT, and that doesn't mean bacon, lettuce, tomato. So it's a BLT cream, and they put that on prior to the treatment. And this will be for both the facial and for the scalp treatments. Also, we have been working with another company, and they're really fantastic. And they have doctors around the United States who are searching for ways to make this painless. So we add calcium chloride and sodium bicarbonate to not only help make this treatment less painful, but actually to make it more effective. Just to add to what Dr. Coles was saying, and just to kind of share with you like how incredibly rich this platelet-rich plasma is, which is from your own body. I mean, that's what's so amazing. It's purely naturopathic, right? It's minimally invasive, highly effective, and all natural, non-toxic. It's a non-toxic therapy. But the growth factors that are found in PRP, I'm just going to read a few of these, okay? Whether you have heard these words or not, but platelet-derived growth factor, transforming growth factor, platelet factor interleukin, platelet-derived angiogenesis factor, vascular endothelial growth factor, which then helps to create new blood vessels, right? Epidermal growth factor, so what's the epidermis, your skin, and insulin-like growth factor. So it can help to rejuvenate the tissues. It can help to rejuvenate the muscles, the nerves, the blood vessels, okay? So as we keep that in mind, as we keep talking about these different areas of the body where you can actually apply this. Hair growth results. So what are we looking at? Well, new hair growth can be seen as early as 2 months, but typically between 4 to 8 months, and will continue to improve up to a year. To date, results have been maintained without additional injections for up to 2 years. So typically, we will do a treatment once a month for 3 months and then allow the process to unfold. Before and after, as you can see, we have hair loss in this area, filling in, hair loss here, hair loss at the crown of the head, and then over time, having more hair growth. Now for the PRP facial. So there's 2 things that we're going to be offering, the PRP facial and the PRP facelift. And we're going to be doing the PRP facial and facelift together for those who want to do that. Now the PRP facial is basically using a dermapen. Has anybody seen that before? It's a micro needling device. So a lot of estheticians will use this. And honestly, this picture doesn't really hold true for what it's like. I've done this treatment on patients, and this is not, it's not this bloody at all because the plasma is yellow, and we're not debriding the skin that much to create all that kind of blood, okay? But the key ingredient in the platelet-rich plasma facial is our PRP, and the platelets release our natural tissue regenerating factors for up to 7 days. Actually, they release them longer than that because it's really a remodeling process. A lot of you know that I do injections like both Dr. Coles and I do the prolotherapy, but we also do neural prolotherapy. And I can tell you, after I've had those treatments or the acupuncture injection treatment, I mean, you feel like your tissue is remodeling, and it is. This particular treatment, it's really actually quite profound. After Dr. Coles treated me, I mean, literally, I have more cheekbone. I have more flesh over my cheekbone. When I wash my face, that's where I see it the most. And where I feel it the most. It's like, oh my gosh, this is what I was like when I was like 35, or maybe 40. But, as we age, we start to have a degradation of our collagen. How does it work? Well, the PRP facial is performed using a microneedling device. Okay, so here's this cool little device, and then I actually brought a needle down too, one of the needles. I thought I'd just pass that around so you can see it. If we can just keep it in the container because they're kind of expensive.
Don't open this.
Yeah, don't open this. Okay, but you can kind of see there's some really, well, it's got a little cap on it. There's some microscopic tiny needles in here that plug into this device. And then what we do is gently take it across the skin. When the patient comes in, we put that BLT cream on. It takes about 20 minutes for it to really numb. During the 20-minute period, we're spinning the blood, we're processing the blood, we're spinning the blood, we're processing the blood. And then we go into the treatment room. And then this device doesn't hurt because we're gently taking it over the skin. Now, when Dr. Coles did it to me, she's got such an exquisitely talented and gentle hand. I mean, she took this, it was like a little kitten, like licking my face. I mean, it was so sweet. Whereas when I was with her, I was like, I mean, she was just like gently, like a whisper over my skin. I learned a lot from her because I'm much more heavy-handed. I'm like, I'm getting results. So it's been great to experience this. The first treatment that I had when I was actually on Maui, and this woman like overcharged me. I mean, she like scalped me. I mean, seriously, but not literally. But it was a completely different kind of treatment, and it was painful. And the treatment I had locally, like I had to make them stop. It was so painful. So I think we found a way to do this. So this is the PRP facial. Now the PRP facelift is where we actually do some very small subdermal injections into areas where you want to really place the platelet-rich plasma. So we do it here over the cheekbone. We did it through these nasolabial folds. She did some in the area that I don't like happening, this whole like chin thing that's happening. Like, what's that? That's not supposed to happen. But anyway, she did it all through here. And then, kind of helps to support some of this tissue coming up. And she also did my 11 lines. Now, some of my coworkers, I mean, they see me every day, and they're like, yeah, those 11 lines aren't so deep. And gee, you've got like, I'm not looking like one of those plastic people, that has all that fake stuff put in. But I have to tell you, my skin rejuvenated. I wouldn't be up here telling you this if it didn't. It was pretty significant. The woman that we trained with, she's a surgeon, a plastic surgeon, and I don't want to look like her. She was just way overprocessed. Why don't we pass that around?
Before and after shots?
She did it before, but we haven't done it after. Yeah, we haven't done after, and I need to get my next treatment. And then we're going to get addicted. We had these jokes going that we're going to be there until 10 o'clock at night. And we're going to become anemic.
Our face will look great, but we'll have these black bags.
Right. Because we're going to be so addicted to this. But this woman that trained us, I don't think anyone in this room wants to look like this, or any man. She, they look a little bit like mannequinish. She didn't look real. But she did say in her practice that this is the one therapy that gives you vibrant, lustrous skin. That there is no other therapy that actually gives you lustrous skin. You can stick plastic in here, you can put stitches in here, you can take a string now and string it up. There's so many things that can be done, right? Oh, Botox, remember Botox? Which scares me. Something just about sticking botulinum toxin that close to my brain. It just seems like that just cannot be okay. So, this was one thing that she said really helped her patients have vibrant, lustrous skin. Okay, so what we do is we take the Dermapen and we actually gently take it over the skin. Then we put the PRP on top. Then we put this over the skin again to allow the PRP to go down through the skin layers. Okay? Does that make sense?
Does it take a long time?
No, it doesn't. What takes a long time is drawing the blood, spinning the blood, processing the blood, spinning the blood. But in a way, it does take concentrated effort to be completely focused and uninterrupted. I know for the physician. You don't want anyone interrupting you. You want to be right on spot, right on target. Because we're adding some things to the PRP, like the calcium chloride as well as the buffering agent, we have 3 minutes in order to take that one syringe that we've adjusted to the right pH and be able to utilize it so it's not painful. So when we do the injections. So for that reason, we need to do one syringe. And it can take time because then when we do the next syringe that we're going to inject, we need to also put that in there. We just need to be ungloved, put new gloves on, do it again. So it doesn't take that long, but it is time-consuming in a way. So I would say I'm going to block off 2 hours for every patient that comes in because I don't want to be rushed, I don't want to be stressed, I want to be completely focused.
Can you back on that one?
Oh, sure.
On the sun-damaged skin, does that get rid of the precancers on the face?
I will say no, it doesn't. But it will support the tissue around it. I think when we have already the actinic keratosis, is what you're talking about, those pre-cancers, we need to actually take care of those first. And then we can do this afterwards once the skin has healed. So PRP facial can help with rosacea, which is a type of acne. For people with scarring acne, the PRP facial along with the Dermapen, there's research showing that it can be very effective, in fact more effective than the Dermapen with vitamin C. So I have a study here that I pulled off of PubMed on that, and if anybody's interested in that, I can refer you to that study. Maureen, you had a question? No, she didn't. Okay. So it can help with acne rosacea, can help with our crow's feet, dark circles around the eyes. One of the things that we were trained to do is actually to use the PRP, just tent the skin and just go right underneath the skin, underneath the eyes, very gently, so as not to create any bruising. You had a question?
Yeah. Would you use PRP in combination with other things for cheek, under eyes?
So we are not, but I know that other doctors are, where they're putting in some of the synthetic fillers, which we're not going to be using. So we're trying to create an all-natural type of PRP facial treatment versus PRP with one of those synthetic fillers that they can do. And that's called like your typical vampire facial or vampire facelift.
I'm sorry to interrupt you.
That's
How long
fine.
does all this last? Let's say you do this for me and I look fabulous.
Yeah, I would say once a year. We do you do a treatment, January, February, March, you've got it for a year. And then come back January, February, March, or whenever you want to do it.
So it's a
Yes,
free-
Janet.
What is your recovery time after a facial?
Okay, well-
Obviously you had all that
well-
there, so do you go back to work like after the 2-hour process?
No.
Or do you set a 2-hour
No, I'm going to set it up so I treat people Fridays and Saturdays for this, because if we're going to do the facials, I mean, if it's a joint, then we can pretty much do it any time. I think Dr. Coles needed 2 days recovery because, we were experimenting, and, she's got a pretty high pain tolerance, so this little device, we turned it up and made it a little bit deeper, and like I said, I was a little more heavy-handed than she was. I used to do deep tissue massage for a living, right? That was my job. And my recovery time, she did me my face on a Tuesday night. I had Wednesday off, and I showed up to work Thursday with no makeup, nothing, because I really wanted everybody to see, and even the patients to see, and I maybe had like a little scab left, and I just, didn't touch it. Afterwards, I put on a vitamin C serum. That was wonderful. We have also purchased these lovely green tea face masks that Dr. Coles put on. You want to tell about your experience of using this? Yeah, come on up.
So these babies, I stick in my fridge, I cool them down, and then afterwards you put them on, like when I got home, and just the cooling, it's going to help decrease bruising, because when you're doing the facelift with those injections, there is a mild risk of having some bruising. It's going to decrease that, though, when you get the cold on there. It's green tea. These have no parabens. They're completely natural. There's a little bit of hyaluronic acid. They're amazing. I love them. We have like the under eye circle ones already in the office, but these masks, you put them in the fridge, stick it on, and just relax for 30 minutes. Great. And then the green tea is a really powerful antioxidant, which is great for your skin. So for fine lines around the mouth, now this can be painful. You've got to be very gentle through here. For dull, rough, or gray skin tone, texture, for sun-damaged skin. I mean, I'm a swimmer. I've got some sun-damaged skin, but I don't have currently actinic keratosis. If somebody has a big basal cell on their face, basal cell carcinoma, we're not going to be dragging this dermapen over it. Or if there is a suspicious-looking lesion on their face, and I'm going to definitely be sending them to a dermatologist. Acne scarring, I think this is a really key area for men and for women, because that's something that once the scarring is there, it's very hard to get rid of. And by doing this platelet-rich plasma into this scarred tissue, I mean, there's been significant changes in the skin and decrease in the scarring, because it helps to rejuvenate the skin. It helps the skin to grow, supports the collagen, and for aging skin. Results for firmer, more youthful skin, reduced appearance of fine line and wrinkles, improvements in skin quality, color, texture, fresher, more youthful, natural appearance. I feel like a commercial, like we're selling orange juice. Skin appears smoother and healthier, and then inflammation caused by acne or acne rosacea improves or resolves. And then pronounced effects are generally seen 4 to 6 weeks after the procedure, and the improvements can last for more than a year. And again, I think it's really a series of 3 treatments once a month that make the difference. So January, February, March. Yeah.
Will this take away cellulite?
I don't think so. Yeah, it will?
Yeah. There's actually quite a bit of research on
Okay, go for it.
using the microneedling with PRP for cellulite on the posterior and the thighs. They've found that doing the microneedle with it does, because what it's doing is the microneedle is going to puncture tiny little pukas all over. And because what cellulite is it's this banding of collagen around fat cells, which has a bit of a genetic component, and women are much more prone to it. But when you sort of expand and puncture into that sort of collagen matrix, it will break it up, and that PRP will go in and allow that tissue to rejuvenate. Very cool.
Oh, very good. We have a new modality. Wonderful. We've already talked a little bit about this, but it's really just about injecting now the PRP specifically into targeted areas on the face. So again, to decrease wrinkles, plump up the sagging tissues. There's no doubt I feel like my cheekbones are plumped up, rejuvenates your skin, contributing to the appearance of a younger version of you. So we would take this little device here and place this right here so that it's not so painful, because it's a distraction. Anytime you have two people pinch, if you pinch and give someone an injection, they're not going to feel it. They're going to feel your pinch. How many of you have experienced that? Yeah, or have you noticed that your dentist wiggles when he injects? Well, we have the wiggle technique down too, because we do a lot of injections in our practice. Results are very similar. Glowing skin, lifts and refines the skin, smoother skin, diminishes lines and wrinkles, younger, natural shape. It's an outpatient procedure. I would definitely give yourself downtime over the weekend. The future of PRP at Steelsmith Natural Health Center, well, we are so into this that we have invited a urologist to come to our office the end of August. And there are intimate areas of the body where this can be injected for both men and for women. So one is called an O shot. Until recently, there are very few options for women, and PRP can be a game changer if you inject it in the vulvar area and the vaginal area. For women with incontinence, there is a 90% success rate for women with urge and stress incontinence, which means that they leak urine when they have sex, when they cough, when they laugh, when they jump, and that is just not fun. And that is another one of those secret, very distressing things that women can face. I mean, it's as bad as the hair loss, where they come in full of anxiety and what can I do? And there is very good information about this and how it can help. The other thing is it can help rejuvenate the tissues of the vulva and the vagina. So for women who have a lot of pain with intercourse, lack of sensitivity in postmenopause, sometimes lack of sensitivity after giving birth because some of the nerves might have been damaged. Remember that the platelet-rich plasma rejuvenates the blood vessels, right? We need good perfusion of blood into this tissue to have it be functional. It helps to heal nerve, so it helps to increase sensitivity of that area. So it can help with intensity of orgasms, and it can often resolve urinary incontinence.
Is this like the Mona Lisa touch, but a different way?
No, the Mona Lisa touch is completely different. That is more of a laser. This is actually injecting your own platelet-rich plasma with all that potential for growth factors into the tissues down there.
And that hurts when you put the needle in, though, right?
Well, they have a pain-free way to do it. The same people who turned us on to this are going to teach us how to do that. And so here are some of the benefits, and can see increased greater arousal from clitoral stimulation. I wrote a whole book on women and sexuality because truly I have so many women ask me, usually the visit's over and I'm just about to walk out the door and they're like, oh, but one more thing. I just really have no sexual sensitivity and have no interest. And when we do have sex, I'm not there. Just get it over with. So, there was sometimes there's pain associated with, sometimes there's just lack of sensation, but I think that there's a potential solution to some of this, and part of it could be this platelet-rich plasma. Tighter vaginal opening, stronger orgasms, more frequent orgasm, increased sexual desire, increased ability to have a vaginal orgasm, decreased pain for those with painful intercourse, increased natural lubrication. That's huge. So many women, as they are after menopause, just don't have the natural lubrication anymore. And then we already talked about the urinary incontinence, both the urge and stress incontinence. Now there's also a shot for men, and we were very impressed that 2 men came this evening because it looked like our list had only women, although I did recognize Vern's name. But we are going to be learning how to do this as well for men, and this will be some platelet-rich plasma injections into the penis, and again to help them with erectile dysfunction and sensitivity. But you know what? I think that this urologist, I mean, this is what he does for a living, and they have assured us it's not painful. So we believe them, and we're going to make sure it's not painful. Sexual wellness for men to help to increase form and function of your penis, have a dramatic effect on relationships. Being unable to achieve or maintain satisfactory erection, or even feeling the size of your penis is inadequate, can affect your self-esteem. You know, I really don't want a practice full of men wanting their penis to be larger. You know, I mean, that's like not really the goal here. But if I'm treating a female and she has a wonderful, loving partner, and you know he has interest, he has ED, and he wants to try this, I think it would be, you know, it is a viable option. I mean, it's a viable option. And then sexual wellness for men. I mean, I think we've all heard these statistics before, that, you know, 52% of men suffer from some form of ED, and as men get older, they tend to suffer from it more. And there are many things that they can do for erectile dysfunction. There's herbal formulas. I have a whole chapter in the Great Sex Naturally book on what men can do for erectile dysfunction. And, you know, and sometimes it's even just better communication, you know, between the partners. 80% of ED goes unreported because both practitioners and patients are not comfortable discussing their sexual health. And the risk of sexual dysfunction does increase with hypertension and big time with diabetes and imbalance in their fats, dyslipidemia, cardiovascular disease, smokers. So basically there are solutions to sexual dysfunction that men deserve to know about. 1 in 2 adult males between the ages of 40 and 70 will have sexual changes they consider problematic, and perhaps the P shot will be helpful for them. So, questions and answers. Yes?
I didn't see it on there, and I don't know if it was under the rosacea, but my daughter has pretty severe melasma.
Melasma.
Is that something?
Yeah, I have a patient with severe melasma, and before we actually brought the PRP on board, I sent her to another clinic to do 3 treatments, and it drastically helped her. And there's some research on it that does show that it's very, very helpful for melasma. Mm-hmm.
Good. You know,
She is in Canada. Are they doing this in Canada?
Yes, they are,
Oh, good.
for sure. You know, another thing to give her is a really good quality vitamin C serum. I started getting some melasma when I don't know, you know, I'm a hormone specialist, right? So I started giving myself some hormones. I was like 38, 39. I didn't need them. And I started getting some melasma on my face. And the HydroCool vitamin C serum that we carry in our office, and I think we're still carrying it for patients, but it's by Is Clinical. I mean, that completely cured it. I mean, like, and mine was very, very mild, but it made a profound difference in melasma. Yeah. Other questions?
What is melasma? Yeah.
Oh, what is melasma? It's a depigmentation of the skin that's often related to hormonal changes. Sometimes women get it in pregnancy. Mm-hmm. It's called the mask of pregnancy. It's sometimes even referred to as cloasma. Melasma, cloasma, mask of pregnancy, they're all the same thing. And it can happen with hormonal swings. It can... Birth control pills, hormonal swings, sure. Oh, I had a friend who went to Africa as a volunteer with the Peace Corps. And before she went, she had to get on the birth control pill. And she spent 6 months in the African bush and never looked in a mirror. And when she finally did, she had a complete mustache from melasma. And that was a disturbing thing for her. Now, getting off the pill, helping her liver clear the hormones, I mean, that's a lot of what we did with her. And that also helped, getting her hormones back to balance. So it did eventually fade away. Yeah. Oh, I have another case. This is when I was just like 30 years old, when I probably met you. And I mean, some of you have known me like my whole career. I had a patient come in. She looked like a mime. Her melasma was like a teardrop, like this, and it was from being on Premarin. And for her, what we did was, again, we treated her thyroid, and we really helped her liver to detoxify. So, and that helped to clear it off, and obviously get her off of Premarin. Yeah.
And the PRP help with enlarged prostate?
I don't think so, unless you have something else up your sleeve. No, I don't think so. No, because we can't really get to the prostate, right? And the prostate's enlarged. Prostate's deep in there.
That would be a little deeper of an injection than I think we're allowed to do.
Right. Right. Yes.
Dr. Coles mentioned that if you have a tennis elbow and a knee issue, that you could perhaps do both in one treatment, or would you have to do those separately, or does it depend on the amount of platelets?
No, usually two different joints are probably going to need a bigger amount. So there's actually different kit sizes. There's a 30 ml kit size, which are the ones we have currently. There's also a 60 ml kit size, which would double that volume. If we potentially had someone that we, met with and knew that we needed to do more and they wanted to do it all at once, we might have to order a different kit size. That is going to change the cost, though, of course. But two different joints probably need more than what we're going to get in a 30 ml.
Any other questions? Yeah?
On the scalp, do you treat
Oh,
the entire scalp?
so we can use the Dermapen. That's what's really lovely about this. So we don't have to just do needle injection, but we can actually use the Dermapen on the scalp. Okay, and this is very gentle. So it's lovely. I mean, estheticians use this. You don't have to be a licensed doctor to be able to obtain one of these. But to be able to do injections, you do need to be a licensed physician to be able to do injections. So yes, you can do this. You can do a very broad area of the scalp. Yes, Karen. Yes, Karen.
Double chin, you can do it, help that. Also, I had a Mohs technique done for stage 0 melanoma, and I have some nerve where I can't feel. And I heard you say something about nerves. Would it help bring that back?
Potentially, there might be some other treatments as well that we might think about for that, because we do have some other types of regenerative injections that are very useful on nerves, so that would be something to kind of discuss.
Well, what you do is you bring the cheekbones up, and that can help, right, to bring all this stuff up. Well, I want to thank you all for coming. We're going to hang out here for a little bit. Yeah, so if everybody has did everybody get a green folder? And if you look inside, go ahead. Oh, okay.
So one of the benefits of coming and attending tonight, not only did you get to learn everything you want to know about PRP, hopefully, but we're also offering a special just for you all for tonight, and there is a coupon in there. We're giving you close to $100 off a single PRP treatment, and then if you do a package of 3, it's actually more like $160 off per treatment. This special, we're running this for you guys for 1 week. That's why we're collecting all your names. So if you call and you want to take advantage of this special, we know who you are and you can do so. So if you're interested, definitely let us know. Yes.
What's the difference between one of the facial treatments versus facial acupuncture?
Well, the facial PRP uses PRP. Facial rejuvenation acupuncture is only using the acupuncture needles. So you're getting the stimulation from the acupuncture needle, but you're not getting the growth factors and the stem cell recruitment that you might get with PRP.
So that's the more effective one, the latter, the PRP.
I like to think about, if I was going to think about a true all-over facial rejuvenation protocol, I would actually probably incorporate both, but that would be, a discussion I would have with the individual patient. Now, we haven't talked at all about facial rejuvenation acupuncture, but there's some acupuncture techniques in the face that rejuvenate the face. They lift, it pulls, it does all sorts of beautiful things. I would combine the PRP doing the 3 treatments spaced a month apart with probably the facial rejuvenation, maybe in a 2-week increment with it, or the months after, to kind of improve and increase that collagen production and that lifting effect. Yeah.
Do you have before and after pictures?
We do in a booklet up here. I think we don't have any up on the slideshow.
Something we can see?
Yeah.
Great.
Yes.
A couple questions. Can this help disc damage?
Well, if you have a herniated disc, which is a disc that has kind of herniated, you don't ever want to inject into the disc itself. That would actually potentially cause more damage. So you do not do any injections into the disc.
And does everyone's blood have adequate growth factors? Like, doesn't matter how old you are or things like
That's a good question. The only things we know is that if you are low in platelets, you're not going to have adequate growth factors because you're not going to have enough platelets to recruit. Really, other than that, everybody should have adequate platelets if you're within your normal range.
So, like, I wouldn't do this on somebody who just went through chemotherapy, right? Their bone marrow is trying to recover. They're more immune compromised, right? So you want to, this is something you also want to do on fairly robustly healthy people. I do want to say that one thing that when you inject the PRP into a joint, and even when we do prolotherapy, and a lot of the injection techniques we do, like the acupuncture injection treatment some of you have had me do on you, you can actually kind of irritate and stimulate the tissue, right? I mean, you can sometimes have an inflammatory response. The patient comes in with this much pain, and like they next day they're like, hey, it hurts more. Gosh, this isn't fair. And then 2 to 3 days later, it's like, oh my gosh, I have relief. So, sometimes there can be an aggravation before there's, full recovery. And the same thing happens on the face, right? You're kind of irritating it with this, dragging this needle across it. But through that irritation, you're also, recruiting, you're stimulating collagen production. I mean, even with just this alone, you're stimulating collagen production. That's why estheticians use it. But then you add the PRP to it, and it just kind of goes exponential. Yeah.
Does this price include the PRP facial, or is this the facial price?
So if you wanted to come and just do one PRP facial, we wanted you guys to be able to try it for one and get the discount. But we do recommend the package of 3. But let's say you do one and you're like, I hate this, I'm not doing this. You don't have to buy the package of 3. So that's why we gave you that option.
There's 2 different.
Right. So this price includes any PRP treatment because the price for us of drawing and doing it is the same with a 30 ml kit. So, yeah.
So our costs are actually really high to do this. That's why it's expensive.
So you would do the pen and the injection.
Whatever you want.
Whatever
you
want.
will tell us and we will, your wishes.
Awesome.
Yes.
So, sorry, if you wanted to do the facial esthetician one plus the injections,
same price.
That's 2 different, that would be considered 2 different things?
Nope.
On that one day?
No, nope. No, because we'll get enough PRP to be able to do the PRP with the Dermapen and to do PRP injection.
Okay, and do you have somebody like really special up there that can find veins for people like me?
She's unbelievable. I mean, seriously, she's magic. I'm good, but she's like unbelievable.
I just do want to note, if you wanted to do a hair restoration treatment and a face, that could not be done in the same visit because there is not enough PRP to do a whole face and a hair.
Unless it's just the hairline. Like if it was just this hairline, then we could have enough. But if we're doing the whole scalp and the face, there's just not enough blood to do it. Now, if you really want to do that, we could get a 60 ml kit, and that just costs more. But this is all based on the 30 ml kits. Okay, just like
real quick, sorry.
Yeah. Yep.
When you go to the doctor and get a normal blood test like a CBC, how many mils are they taking in? And you get those 3 vials. I'm just curious compared to how much.
It's about 5 mils. One tube.
So that's 15, so double that. Yikes.
Well, it depends on how much they're drawing. Like when my patients go get their blood drawn, they're usually getting about 6 vials drawn. Yeah. It
just divide it up rather than 1, 2.
Yeah.
Yes, Maureen.
I don't react well when things are scraped around me. I get a histamine response. Can you take an antihistamine before you do this?
Yeah. You just don't
Yes.
want to take ibuprofen or something that's going to thin your blood. Or lots of vitamin E and fish oils. And that's a very good point. Thank you all for coming. We so appreciate it.
Thank you.
I was like, why did earlier?